Hello and welcome to the Refugee Welcome Collective Lunch and Learn series. In these sessions, we aim to bring interesting and timely information to you, supporters of refugees. Whether you are a volunteer, community sponsor, resettlement agency staff, a local advocate, or just someone who is interested in learning more, we hope you enjoy today's session, Connecting Newcomers with Healthcare Providers for Ongoing Access. Here at Refugee Welcome Collective, we collaborate with partners to provide in-depth training programs, weekly learning sessions, resources, and on-demand technical assistance for sponsors, practitioners at resettlement agencies, refugees paired with sponsors, community and institutional partners, and others to support quality community sponsorship programs across the United States. We thank the Center of Excellence in Newcomer Health for their partnership in today's Lunch and Learn. The Center of Excellence in Newcomer Health builds on existing infrastructure and its partners' extensive experience to identify and monitor newcomer health issues and needs, contribute to evidence-based policies and guidance, and ultimately improve continuity of care and health outcomes for newcomers. Next slide. As a reminder for everyone joining the Lunch and Learn today, there is a control panel in the upper right-hand corner of your screen that will allow you to submit questions through the questions box. There will be ample time at the end of the webinar for Q&A, so I encourage you all to enter your questions there throughout the presentation. Everyone on today's webinar is automatically muted. However, if you have any tech issues, you can raise your hand through the control panel or submit a question in the questions box so we can assist you. Additionally, a recording will be sent to everyone of today's webinar. This brings us to our presenters for today. Our presenters are Bailey Conrad, Nadej Mudenge, Janine Young, MD, and Kate Yoon, MD. And let's see, and I will actually begin this presentation by letting them introduce themselves quickly and share a little bit about where they work and any relevant associations. We can start with we'll do Bailey and Nadej, and then actually we'll do Janine, who is joining us via phone, and then we'll wrap it up with Kate.
Great, thanks, Brianne. Hi, everyone. My name's Bailey. I'm a program coordinator at Harborview Medical Center in Seattle, where I work with outreach involving immigrants and refugees. And my previous work was 6 years running a health program at a resettlement agency.
Hello, everyone. My name is Nadej Mudenge. I am currently working at the Children's Hospital of Philadelphia as a clinical research coordinator. And I have been working as a professional medical interpreter for the past 8 years and a half now. And in the past, I have worked with the resettlement agency in town, National IT Service Center, for at least 6 years as a program coordinator.
And Janine.
Hi, everybody. This is Janine Young. I'm a general pediatrician by training and recently moved to the University of California in San Diego, where I'm chief of academic pediatrics and have been working with immigrant and refugee communities prior to that at Denver Health and Hospitals as the medical director of the refugee clinic there.
Hi everyone, I'm Kate Yoon. I'm a general pediatrician at Children's Hospital Philadelphia, where I work within our primary care program and our refugee health program. And I've been working with refugee families for nearly 15 years now.
Wonderful. So we certainly have an experienced group, and we have a few questions here for our panel. And like I said, all the attendees are also welcome to type questions in, which we'll answer at the end. And we'll start with Bailey and Kate, and then anyone else. How does health and public health care begin in the United States for a refugee family when they first arrive?
Yeah, that's a great question. So from a resettlement perspective, there's sort of two main pieces involving health that resettlement caseworkers are required to provide to new arrivals. And these can happen in a number of different ways. But the first is the refugee health screening exam, which is really just an exam that kind of runs the gamut and screens for a variety of illnesses and does immunizations. And the other piece is establishing care with a primary care provider. And depending on the location you're in around the country, these can occur at the same place and at the same time or within a couple of visits. There might also be a model where the public health department in the area does the screening exam, and then there's health clinics that that the new arrivals connect with for primary care. But I think in general, all resettlement agencies generally have some sort of established system for connecting these new arrivals into the healthcare system at those two junctures specifically.
Great, yeah. And Kate, did you have anything to add or?
Yeah, I just want to acknowledge a really important piece of the work that the resettlement agencies will do as part of that connection to care is ensuring that families have access to a health insurance program. And sometimes that's a program specifically for refugees. Sometimes it's the state Medicaid program, but it's such an important step because we know that in addition to the refugee health screening exam, which we also call the domestic medical exam, it's just so important for folks to get engaged with primary care. When you think about just the basic building blocks of life in the United States, you know, I'm a pediatrician. We need kids to have somewhere they can go for their vaccines and their school health forms so that they can enroll right away in school or in early childcare programs. And we want folks to have somewhere they can go also if they have any sort of health issues that need to be addressed more acutely, or if they are just going to engage in ongoing preventive care.
No, great. And so, like well, and Bailey mentioned, you know, a lot of times the resettlement agency might help with that connection. I guess if, you know, the connection is made, but if not, that might be something hospital, you know, social workers or what have you could help with. Let's see, anyone else is welcome to add, but I guess I also wanted to ask Nadej about language access and Nadej, kind of what do we mean by language access, and what kind of language access are entitled by law in the United States?
Yeah, that's a good question. Language access means that families that don't speak English, that have a limited English proficiency, they will have access to same services as are individuals who speaks English. So pretty much all the services that everyone who speaks English can get. The refugee families can receive the same services in their own languages. So by law, refugee families have the rights to request our services in their own language. So the language that they're comfortable listening and understanding and expressing their needs and request services through the agencies, either agencies or medical support or getting appointments, they have the right to request the language interpretation to help them communicating better with the services they're trying to get.
Great. And then what barriers have you seen regarding language access, and how would you advise volunteers or sponsors that they could kind of help refugee families avoid or overcome some of those barriers?
From an interpreter perspective, I think the big barriers has been the dialect. So people can be from the same countries, but they speak different dialects. And an example is that sometimes technically the language can have the same words that can be used, but also they can be misunderstood or they can create some gaps in communication due to the differences of those dialects. So it's very important that when the sponsors are requesting for interpreters, they clarify which language and which region of the language, if that implies which language of the dialect that they are trying to get. And also another barrier is the culture. So language is not just having the ability to speak words, but also understanding the culture that involved with that language group, it's very important when they're requesting services, because it can help the person who is being interpreted to understand better what is being said or ask for them to do. And also it can allow them to ask questions. And my advice for people who are helping their refugee families is when they are helping them accessing services or even getting appointments, to assist them getting appointment for the interpreters as well. And when they're requesting interpreter services, also making sure that the person language is right, it's correct. Because sometimes you may have the person writing down that they can speak English and their English can be very minimum, or maybe they have a well of English, but since they're coming into a new system, there can be a lot of complexity on how they understand these things in their own language and how it's being interpreted in English. And also encouraging the family to advocate for themselves when it comes to accessing the language services, and also encouraging them to speak clearly, so that's speak clearly and be clarifying, so that people can be able to assist them, especially interpreters can be able to assist them. And also in some cases, if families are working with interpreters that they cannot understand for some reasons, either it's culture or it's it can be dialect, they have the right to request for another interpreter who is appropriate to the region of where they're coming from. So I think that can be like some of the advice I can share with them.
Yeah, no, that's good information. And in the first question, you had also mentioned, I think, maybe you mentioned that folks could have interpreters for like appointments, but is it also like in making appointments? Are they able to have interpreters in kind of like scheduling as well?
Yes. I think most of the services right now, when you're calling and you want to schedule an interpreter, you can at least tell them the language you speak. You can say like Russian, please, or French, please, and the person who pick up your call can understand actually that you're requesting the French interpreter. And that can even give them time to connect you to interpreter over the phone and assist you to make your appointment.
Great. And did anybody else have any? Yeah.
I just have a quick comment to add. So if you're in a situation where someone is not providing interpretation, in my experience, it's usually a systemic issue and it's not going to be solved by that person who's, a front desk or maybe just running the office and doesn't necessarily have the authority to change that situation right away. And so that's where it comes back to working with resettlement agencies who have close contacts with clinics and know the clinics that understand that their clients don't speak English. And usually, in my experience at least, it's been kind of the specialty care places, like maybe a specialist dentist or someone like that, kind of a clinic that might not be used to interpretation, who should be providing it, but they're not. And so as an advocate, what I've done is go back to the primary care provider or whoever is providing that referral and explain the situation so that the person can get a new referral, while also trying to advocate up to the state or whoever to express that this clinic isn't providing interpretation correctly.
Yeah.
And
I'd like to add. Oh, sorry. This is Janine. Sorry, I'm just on the phone. This is a really complicated issue, actually, nationally, and I agree with both of the other panelists about everything that they've said. There are systems across the country that, to make an appointment, your only option is a phone tree that's in English and Spanish, which makes it really impossible and quite difficult to navigate for newcomers who don't speak English or Spanish. And so one of the things you can do is try that system yourself first, particularly if they're saying, I can't get through, because sometimes there's systems where there's not even a human being answering the phone. We've all experienced that. And so trying to figure out workarounds, I know this doesn't sound fantastic. I think there are significant systems barriers nationally for non-English speakers in general, and much more so for non-English, non-Spanish. And so I think it's trying to figure out the workarounds that are going to be functional for wherever you are regionally, and then empower the person you're working with to use that workaround. And this also is an issue for folks. You're going to be working with people who are pre-literate in their primary language. There are some families who don't, especially, parents who might not know how to read numbers also. And so really supporting them with, not just telling them about 911, but actually programming it into their phone. I think there could be a whole conversation about support and barriers to care nationally for language issues. And I'll stop there and let my colleagues continue.
Yeah, I would just add for anyone who's on the webinar who's sort of newer to helping families navigate the healthcare system, a large health system, so for example, a federally qualified health center network or a hospital affiliated clinic will usually have contracts for 3 kinds of interpreting: in person, video, and phone. And so just to that point about making incoming phone calls, if it is a phone system that allows someone who doesn't speak English or Spanish to eventually get to a person, and I second Janine's point about testing the systems, there are some systems where if you simply wait on the line and don't select any option, eventually it will default to a human being. But at that point, you can say French, please, or Arabic, please, or express the language need. And the front desk staff or the scheduling staff at that point should be able to patch in a 3-way call with an interpreter. And so that's typically how a phone conversation would work. There are, as Bailey alluded to, some smaller programs that may not have their own contracts, and they may instead be expecting the caller to be working with their insurance. So in some states, some insurance programs provide a telephone interpreter. And so it's worth knowing your particular landscape so you know it's available to you. Because if the insurance is expected to be the source of phone interpreting, then you would want to call the interpreter first, and then they would patch in the 3-way call to the clinic. But typically a larger health system is going to have a phone service that they could add to the call.
Yeah, and I like the wording too of like kind of trying it first, or like trying it out, but then with the ultimate hope that then they would be able to do it, themselves or what have you, so that you could say like, oh, if you stay on, until for 2 minutes, eventually you'll get a person. But yeah, sometimes that requires you trying it out first, so that then they can do it on their own second.
The other thing I wanted to say about this that Kate brought up is this idea, or actually both, everyone has brought up, is this idea of sort of, if you identify significant systems barriers in your community, is going back to the resettlement agency and or going back to the state refugee health coordinator and explaining what the barriers are, so that you could actually, even if you're interested, advocate on a larger scale for language equity and language access. I mean, it's a larger ask, but I think this is a huge issue nationally, and it's a real systems barrier for access to healthcare and other services.
Yeah, no, great. So kind of like all those levels, some of the things that like Nadej started us out with just making sure that the family or individual themselves is requesting it and speaking clearly and asking for their dialect, not just their language or what have you. But yeah, on all of the levels, and then some of these more systemic as well. Let's see, Bailey and Kate spoke at the beginning of the presentation about connection to primary care physicians. If you were a volunteer or sponsor, would you also offer to assist with connecting with other healthcare providers kind of beyond that primary care provider? And if so, which providers? And actually, I think, Janine, we're going to let you start us off with this one.
Yeah, thanks for this question. This is really important because, I mean, as we all know, you're orienting as a volunteer a newcomer to get to their first domestic medical examination. But what comes out of that is the need for primary care and establishing with a new primary care provider who's going to see that patient ongoing and periodically. As a pediatrician, for young kids, these well child care exams, if they're infants, are every couple months. And part of this, the resettlement agencies and the folks, the medical providers who are doing these screening exams should be educating families about the importance of primary care and preventive medicine, because in most countries where newcomers are coming from, primary care and preventative medicine does not really exist. You're lucky in some places to have one medical provider for 20 to 50,000 people if you're coming from areas of sub-Saharan Africa, or people use emergency rooms and just ad hoc when you're sick. And so again, the idea of preventive medicine doesn't really exist. And so how do you support newcomers and understanding that it's not just this first exam, and that, when did the doctor say you need to go back? Do you have any paperwork that you were given? Because that often happens and they can't read it. What's the plan? It's really overwhelming to go to a domestic medical examination. You try to put yourself in people's shoes of showing up in a new country, not speaking the language, not knowing the culture and everything that came before. And so it's hard to kind of remember everything that happens. And, often these domestic medical exams happen either over 1 day or 2 days. And so it's, making sure they know when their next appointment is, maybe helping them track when that's going to be, because they're not used to doing that. How are they going to remember? How are they going to call? Do you make some kind of, get them a calendar and actually show how to use that? This is all new stuff. I think, again, this is pretty complicated. They come out of domestic medical examinations with prescriptions. Think about that. How do you fill a prescription? I mean, I think it's hard enough for us. How do you find the pharmacy? How do you negotiate that system when you don't speak English? And again, getting back to language barriers, most pharmacies aren't going to have any other languages besides English and Spanish. So again, sort of trying those numbers out and showing people how to do that. And then, domestic medical examinations, the provider will identify often subspecialty needs. Someone needs to go to the ear, nose, and throat doctor, a cardiologist that might be in a different hospital. When that appointment is, how do you get there? Transportation, you can ask the resettlement agency for help with that. But it's really trying to empower families, with learning and the knowledge, so that they can sort of, as you're teaching them and working with them, they can become empowered to slowly start doing it by themselves, which is something that if I were in their shoes, because I think that's all how we sort of try to look at this, is what is it like to show up never having had to do any of these things before? And what are the barriers in our health system that exist for newcomers, where there's not a lot of hand-holding and the systems aren't in place to do this? I'd love to hear what my other colleagues want to say to add to this, because again, I think this is a complex topic.
Yeah, no, certainly. I'm interested in, like from the primary care, and you mentioned subspecialties, and then just the, some of those things like calendars and transportation, but interested in any additions that anyone wants to offer of kind of what some of your most successful steps have been in making those connections.
Yeah, I think for me as a caseworker, it's really figuring out what works best for that person. So if, they remember by writing and they're literate, creating some sort of worksheet where they can write in their own language so that they're able to remember what has been told. Some of it is also advocacy around, you can ask the doctor questions. That's actually expected here. That's a big one that people don't actually know. So sometimes you have to really take a step back and really think through, like Dr. Janine said, what would you need to know if you were just kind of dropped into this situation and you have zero idea of how this system works? Maybe creating a medical binder for that client if they have a lot of children and a lot of appointments, if that works for them. But I think it really all comes back to creating a system to help that specific family that works best for them.
And I would just add, when you think about other health services that a family might need, in pediatrics, we really emphasize dental care. Preventive dental care is incredibly important for children. Dental caries are actually the most common chronic disease of childhood, and they can be really distressing. And so think about your community dental resources and how you might connect families there, in addition to the other subspecialists and ongoing primary care that other folks have mentioned. And then we also, at least within pediatrics, have some other services that we think of as being sort of related to the health of the child, even if they're outside the health system. And so it's probably worth, if you're working with a family with young children or working with a series of families, just starting to learn about early intervention in your state. What is that system? Who runs it in your state? That's a program to offer very early childhood services like speech therapy, occupational therapy, and physical therapy in either a home or a child care center or preschool space. And then we also think about programs like WIC, which is a nutritional program for women, infants, and children. And we do see a good number of children who will come to the United States with malnutrition, specifically undernutrition. We also know that, there are going to be folks who are having babies, and you want to have good nutrition in the prenatal period. And so that program can be a big part of helping folks stay healthy.
And to add on to that, I think, what we haven't mentioned is the mental health needs of families. And I think that is another, again, a whole long conversation in terms of barriers to care, both in sort of cultural understanding of, that depression, anxiety, PTSD, post-traumatic stress disorder, et cetera, actually are real diagnoses. There's a lot of stigma associated with asking for help with mental health issues, both in the United States, but even more so, I think, in a lot of newcomer populations. And so if you, as a volunteer or a support person, are concerned about a family, I think it's reaching out to the resettlement agencies, reaching out to the state refugee health coordinator if there are real concerns, and seeing in your area what systems are available. And that is another area of advocacy, with access to care, but also normalizing that these are real medical diagnoses with real significant implications for the health of the family. And then the one other thing I'll mention is the real importance of making sure that females of reproductive age who are in a relationship have access to evidence-based birth control. Many families who are coming over have not had access to anything, not even condoms, and are using, either the rhythm method or prolonged breastfeeding, withdrawal, to prevent pregnancies, which we know is not so effective, with a high failure rate. And so it's important to make sure that women are getting linked quickly to places that can provide condoms and education and access to birth control to allow for not unwanted pregnancies, et cetera. And I think that that's a huge area of importance as well.
Yeah, and I think, whether it's connecting people with information about birth control or connecting to mental health resources, as you had mentioned, I feel like you guys everybody's saying connections, right? Or connecting with the resettlement agency. And I think that can be a helpful thing to remind volunteers and sponsors as well. And I think that maybe Janine, you just mentioned like good evidence-based information, right? And so to some extent, just to remind volunteers that, that it's that like connecting piece that you can most help with. And to some extent, you don't have to be providing all of this information, or providing all of the resources. But one of the best things that you can do is kind of provide for those connections to the information, resources, or what have you. let me see. I guess one question that we had, and we can let Bailey, and we kind of touched upon this, is what's different in supporting families who are still learning to read and write in their preferred languages, or, you know, like we said, people who don't necessarily, you know, use numbers or what have you. But Bailey, we can start with you and any other thoughts that folks had to share.
Yeah, I think, you know, this question, interestingly enough, it seems like the tips and tricks that you would use would be very different, but actually in some ways they're very similar to how you would approach working with any family. And I think really the biggest thing I can say is meeting people where they're at and asking what works best for them. So for an example, one of the first families I worked with that was not literate in any language, there are 2 parents and 6 children, and I'm thinking, how do these parents remember all of the appointments? You know, all the primary care appointments, dental appointments, immunizations. And so I just asked the mother. I said, "How do you remember all of this if you're unable to, you know, read the reminders that the doctor sends you or what have you?" And she told me, "Oh, I just have a grid in my head, and I remember it's the second day of the 3rd week." And so you kind of have to take a step back and really reframe how you're thinking of things, because these, if you're illiterate, that's been your whole life, right? You've had to adapt to being unable to you know, read or write in your any language. And so in that case, a calendar actually did work because she used a grid system. And so instead of writing reminders, she would draw an icon or use a sticker, and then that was how she remembered to keep track of everything. I mean, she probably humored me and could have just done it in her head.
Now, let's see, and Bailey's phrasing a little bit there, but yeah, but just talking about different strategies, that one with the calendar. Does anyone have any other thoughts or things that worked well?
Yeah, so I mean, I think it's really important to make sure that families understand that the importance of saying that they don't know how to read. I think it can be embarrassing and stigmatizing, but people will tell you, and I can tell you I've been seeing immigrants and refugees for over 20 years. Medical providers often don't ask, which is really problematic, and just assume that someone can read in their primary language. And so there's all this stuff, you know, money being poured into, you know, translating materials, and you hand people paperwork in their primary language, and then they, lo and behold, come back and aren't, quote unquote, compliant with the medical plan when no one bothered to ask if they could read in their primary language. So I think it's a huge problem. Again, something that you as a volunteer can advocate for and ask, and, you know, just say, hey, do you know how to read? And also see if you can link them to services in your community to learn to read. But what we've done, you know, is you take pictures of the medication bottles, and then, you know, print that out and put a sun and a moon. I mean, it really comes down to that. You can look online also to see what people have done. But, you know, if it's twice a day taking one tablet, you draw a picture of a tablet. But I think that resettlement agencies can help with this. I think that social workers in the health system should be helping with that, and so you can advocate for the health system to come up with whatever they're going to do to explain. And then the other thing you can do is, if they have a smartphone, you can record messages with the interpreter on the phone with instructions in their language, and that's another option.
Great.
And
Yeah.
I can add up something quick on that. So another method that we used to use at the resettlement agents to make sure that families get to their own appointments without mixing, like if they need to take their children to a pediatrician or to a dentist, is printing the picture of the hospital, how it looked like, and then put it to their calendar in their house. And also, like, that helps them differentiate which appointment is that. And also about medication, something that Dr. Janine just said. So making sure that if the patient has so many children and then they have to take medication different time, you can actually like record on a date, like save it as an alarm. Every time when it rings, at least you take a picture, you attach it, and when it rings, it will come to a picture to which medication they have to give and which children. And that also has been helping, especially like for parents who are single moms who have so many children and also who can read and write. That has been one of the methods we used to do to help them not confusing the medication of their children.
That's a
And is
great
that
idea, Nadej.
Yeah.
I love that.
And that's like an alarm on their phone, or is it an app, or?
Yeah, just the way you save our dates on the calendar, like on your calendar, like 8 a.m., this is what you have to do. Underneath, you write them a message in the language that's, because there is a way you do in the settings where the alarm, when it rings, it will read out what is writing there. And if you can, you take pictures of that medication and you save it on that day. So if it's like Monday, 8 a.m., the children have to take this medication. I understand it's a lot of work, but it's doable. If there is someone who can help them do that, just put like 8 a.m., children A has to take this medication, and then you take a picture of it, you attach on that day. So when the alarm ring, it comes on the screen.
No, especially if that were something like important that you needed to do, and especially if it weren't like for a year or something like, that like that would be definitely doable for maybe a volunteer or a sponsor to help with. Let's see. I do want to open it up to our attendees to ask you all some helpful questions too. So we'll start answering some of the questions submitted, and as a reminder, anyone joining us today can submit questions through the questions panel, which is in your upper right hand attendee control panel. Let me see. One question I have is, folks have mentioned a few different strategies for like appointment management and like non-literate or getting interpretation, but people were asking or about like interpretation cards or something like that. Has anyone used those as far as like giving families cards to request interpretation? Or
I'm not sure if you guys can hear me. Sorry about
we
that,
can
Brianne.
now, yes. You're back.
I knew that was going to happen. I even told Brianne beforehand. One thing I've done in the past that's been super helpful is I will actually text the family a text in English that says, "Hi, my name is blank. I'm here for blank. This is my insurance number," whatever information they need. And then they can actually just show that to the staff if they get lost or not sure where they're going. And that can include the interpretation information. I haven't used a card as much because that, everyone has their phone, so that seems like an easy way to do it. But I've also seen clients who receive those types of cards from other clinics and do carry them around as well. And so I think that can be helpful, especially in building confidence, right? It's really scary if you're not a native speaker of wherever you are and you're trying to ask for services.
Yeah, no, that's an excellent point, or what have you. Let me see, and anyone can also type in any additional questions that they have. We talked a little bit about like connecting primary care providers to additional care providers, subspecialists. Is that something that volunteers and sponsors need to help with, or are the care providers kind of doing that on their own? I guess a question, as far as does that happen automatically in your all's experience once they're connected to the primary care provider, or do you have to kind of ask, hey, do you want me to connect you with a dentist? Or yeah, question as far as does that happen automatically, or is that something that that people might need help with?
Yeah.
People definitely will need help with that. Kate, go ahead first. Sorry, I'm just on the phone. I can't see who's talking or going to talk.
No, go ahead, Janine. I was going to say, I think the same thing as you.
Yeah. So, I mean, I think, referrals are made, and I think it really depends on the system in your states as to how active the linkage to ongoing care and the assurance of ongoing care happens. And so I would ask the resettlement agencies, the resettlement agencies are funded to provide, supports, but they're, often overburdened like many systems in our country. And so I think that oftentimes the resettlement agencies will welcome the extra help that volunteers can give. And I think more help is better than less. And you can ask the family if someone's linking them to dental. It's not necessarily automatic, and it really varies state by state. There are some programs where they'll have care navigators who may be culturally matched, who may help, but that's sort of a new area, and I would say the vast majority of places in the country probably don't have that.
I would just add to be really, really clear, let's imagine a family who sees a primary care provider for their first visit, and the primary care provider says, I recommend that you also see a dentist, and I notice that one child or one person in the family seems to be having a health problem that needs a specialist. The primary care provider's job, depending on the insurance, but typically for most refugees, is to essentially make the referral, but they would not typically be able to schedule that appointment for the family for a wide variety of reasons, right? I don't have a way to know when the family also has a Social Security Administration office meeting or an ESOL class, but also just in terms of resources, it's not something I would be able to do, unfortunately, to schedule appointments outside of my own office. And so I think that's really an incredibly important way that sponsors can support families, because the family might have, okay, I need to see a dentist. I was given a list of dentists. Can you help me learn how to call these dental practices? That would be really the next important step.
Yeah, no, that.
And I'll just add. Oh, I was just going to add really quickly, going back to the literacy piece, oftentimes the way that you get referrals to specialist care in the US is either through some sort of electronic email type system or on paper written out. And so if you're overwhelmed and trying to keep up with all the things a doctor is telling you, and they provide you with a piece of paper that says, here's your referral, and you don't speak or read English, that can really be difficult to follow up on, especially when you're getting all different paperwork from a variety of sources. I've had a lot of clients say America has too much paper. And I'm like, yeah, they do. And so I think, one system for that you could set up with a family you're helping is, if you need help, send me a photo of whatever you get from the doctor, or I'll come over and look at the paperwork, trying not to overstep into knowing about their healthcare if they don't want you to, but also being there to sort of help them actually get connected to those referrals. And I think also, if a family has a lot of children or a lot of people in the family, a lot of referrals, there's a lot going on, especially for those who are sicker. It's also a good reminder to say, like, there are some things we can hold off on. We can have a dentist appointment in a couple of months, but your child really needs to have PT every single week. So really trying to just work with them to figure out what is going to be feasible for you and how can I help you understand what you're supposed to do next.
Yeah, and I think that's helpful too, like talking about, volunteers and sponsors can help with these referrals or what have you, because sometimes the doctor's office isn't able to do it. Like you mentioned, Bailey, I think it's important to remember to like photos, like if you can say, oh, do you want help? If you have time, you can say, oh, would you like me to help you connect with a dentist? But they might say no, and in that case, then you don't necessarily have to, or you could, make a picture with the dentist and the phone number, so that if someday, whenever they did get there, or mention, Janine had mentioned like early intervention programs. So if they are working with some sort of program, you could say, oh, well, whenever you are, ready to connect with a dentist, I bet, like so-and-so would be able to help you, or, like maybe, ask your primary care physician again or what have you. So I think that's helpful too, that like you were saying, you can offer to help with some of these things, but also it might not be the time, or they might not take you up on it, or they may want to ask their neighbor instead of you, for help or what have you.
I would just offer one note of caution. If you're triaging or prioritizing referrals and you're not certain what's important, please make sure to help the family ask their primary care provider, because it might actually be a case where the dental care is a very high priority, and hopefully that would have been shared with the family, but sometimes those details could be lost in sort of the busyness of getting established in the US.
And Kate, you really bring up a good point, which is also, families may come with more acute health needs that they might share with you that wasn't, when they first arrived, that wasn't shared overseas for various reasons, or wasn't, shared with the resettlement agency. And, one of the hard things for our colleagues in the resettlement agencies, there are no healthcare providers, there are no medically trained people in the resettlement agencies. And so they may be told some medical information even before an arrival is seeing a physician. And it can put them in a really difficult position. And I think, not to scare you volunteers out there, but, you're not, I would assume most of you are not medically trained, and the role as a volunteer is not to do that. And so if someone does share information, severe pain, you would do the same thing, I think, as advising a family member is helping them negotiate getting to an emergency room or an urgent care, or to their primary care physician. And so even learning the primary care physician's office, how do they deal with urgent issues? Do they have a 24-hour line where they can somehow work around accessing it in their primary language? When should they go to the emergency room? Because a lot of families, again, in overseas, the only way to get healthcare was to go to an emergency room, irrespective of issue. And so explaining that that's not the way to do it, and explaining what an emergency is. But, there are questions and issues that you're going to be faced with that you might not know the answer to. So also just knowing how to negotiate systems, I think, is incredibly important.
Yeah.
And that's also awesome. Oh, go ahead, Brian.
You're probably going to say the same thing I am. Go ahead, Bailey.
Oh, I was going to say, it's actually also a really good opportunity to have the actual family call themselves. So if they come up to you, like everyone has mentioned, yes, we are not clinicians. We do not want to provide clinical advice. Even if you think something is more important than something else, I would never make that assumption. So if someone is having trouble, managing their referrals, or doesn't understand something, it's actually really less of your job as a volunteer or sponsor to figure out what that is, and more of connecting them back to the person who can provide that information. I really, as a caseworker, always called myself an information broker. I was the person that was just connecting people back to the experts in whatever field. And so it's a good opportunity to have them practice calling maybe with you, asking for an interpreter, figuring out how to ask these questions, and then you can help them with the next step.
Yeah, I want to echo that, the importance of calling with. Three-way calls can be really, really important, because it gives you a chance to offer sort of, moral support in a way, but you're also allowing a family to take a step in learning how to, navigate access to a sick visit, for example, at their doctor's office.
Yeah, no, exactly. Connections through three-way calls as well. And I know that we could keep talking about this, and I know that I, for one, have gained a few different practical tips that I could use when needed. So I do want to thank all of our presenters today, and thank everyone for attending. We would like to hear from everyone, so we'd like to receive feedback on any of today's Lunch and Learns, and hear your suggestion for future topics. We ask that you take a moment, Grace, if you could advance to the QR code, and use your phone to follow the QR code on the screen. If we can get there, we might be frozen. But if not, we can also likely chat it in, or you will also receive before the end of the day an email with a recording from today's presentation. And on that email, there will also be a link that you can fill out the survey and give us some feedback on today's webinar. And like I said, I do just want to thank everyone, Nadej and Kate and Bailey and Janine via phone for joining us today. And on behalf of Refugee Welcome Collective, thank you and have a wonderful rest of your day. Thank you all.